Hello, friends. Today I will share a story of a young woman with you who could not get sound sleep for almost 4 years. So, she was a 40-year-old woman who consulted me recently, and her main problem was that she was not able to get good sleep at night, and that was mainly because of some kind of discomfort in her legs. She couldn't say it was pain, but some kind of discomfort, which, the moment she lay down on the bed, it would start and she would have to get up, move around, or sometimes jerk her legs. But whatever she tried, she could hardly sleep for a few hours, and then as a result, it would affect her next day also. And she was a teacher, and obviously she could not focus in her job. She couldn't, spend good time at in the school also. Another problem she had noticed was that when she used to do long road journeys or train journeys, again similar thing would happen, and she would need to get up, move, jerk her legs, and then this would get better. So she was from a small place in Karnataka, and then she consulted a few doctors nearby her home, and one doctor got her MRI of the spine done, thinking that there could be nerve compression, and he did find some small disc bulges, and for that he advised her physiotherapy and also some pain relief medications, but that was not of much help. Then she was also referred to a psychiatrist because they thought that it could be all in her mind, and so the psychiatrist also saw, and since he couldn't find much, she was also given a trial of antidepressants, anti-anxiety medications, but that also did not help much. She could get sleep with the medications, but her discomfort did not get relieved. And also she went through some of the common blood tests like vitamin B12, vitamin D assessment, and all were almost normal. So like this, almost 3 to 4 years had passed, and then her husband couldn't see her anymore suffering, and so he decided to seek the opinion of neurologist, and that's how she reached to me. And then I listened to her very carefully because we have been taught by our teachers that if you listen carefully to your patients and long enough, most often they would tell you the diagnosis. So that is one of the habits which I picked up from my early days. And as she was describing, it was very typical of a disease. So, and then one of the underlying disorders for that can be easily diagnosed with a simple blood test. So I did not ask for any major investigation, just one simple blood test, and that was ferritin, which we got the result in the next 3 to 4 hours. It was low. It was very low. It was 4 in her case, and the normal, and that reflects some kind of iron deficiency. And this was the condition of what we call restless leg syndrome, where the basic pathophysiology is brain iron depletion, and the best blood test to assess the iron stores in the body is serum ferritin. And here I would like to highlight that even if we check serum iron directly, it may be normal in more than half the patients with restless leg syndrome. And also sometimes we check hemoglobin, that also could be normal. So what is important is that restless leg syndrome, which can occur due to other causes also, but in this case it was idiopathic where there is no specific cause. In such cases, it is the iron deficiency which is the cause, and for that, the single most important blood test is ferritin. So, if it is less than 75, it is suggestive of restless leg syndrome. If it is below 50, it is highly suggestive of restless leg syndrome due to low iron stores. In her case, it was 4. So, we had hit the diagnosis which eluded her for almost 3 to 4 years could be made in about 3 to 4 hours. So I discussed the diagnosis and underlying cause with the patient as well as her husband, and I reassured them that it is highly treatable. There are good medications. So I started on iron supplements and also certain medications to relieve her discomfort. And within few weeks, she showed a dramatic response. Her leg discomfort improved, her sleep quality improved, and again she was able to enjoy her work, and she was not scared to, go to sleep at night. And her days at school and also the nights were better because of good sleep. And so, in summary, I would like to highlight that in restless leg syndrome, the main symptom is some kind of discomfort which the patients don't like in the legs. It can also affect the hands, and that typically occurs mostly at night or when the person is sitting quietly. That can happen, during long road journeys or train journeys. And to get relief, they move. So they jerk the legs or they move around, and that gives them temporary relief from symptoms. And the underlying cause, as I mentioned, is low body iron stores, and it can be checked by doing a blood test called serum ferritin, and treatment I've already mentioned. So I hope you learned something useful, and it could be helpful in future also.